ये ये we have a few recordings for you. This is how a normal umbilical artery forward diastolic flow is seen. There you see a forward diastolic flow. This is normal flow. Share. Now this is again artery. The direction is different, but you will be appreciating that forward diastolic flow is absent. The diastolic flow is absent in between the systolic beats, indicating that there is no flow in between these two beats. This is fetal distress. There you see. Again, you can appreciate that there is no flow in between, indicating fetal distress. Now we will see the middle cerebral artery. There you see the anterior, middle, and posterior cranial fossa, and here it will appear on the greater wing of the sphenoid. At this place, we will be able to see here the middle cerebral artery. I'll show you in a moment. There you see the flying monkey sign, the two arms, the head, and the two legs. This is the flying monkey. This is the circle of Willis, and this is the middle cerebral artery. And look at this. This is normal middle cerebral artery flow. There is forward flow and there is tall systolic peaks, normal. We calculate the different indices, resistivity index and pulsatility index of these arteries to interpret their. Now here you can see the umbilical vein going into the liver. In this patient who was having marked ascites due to RH incompatibility, you can see I have put a needle inside the vein of this fetus. I will show you in a moment. This is ductus venosus. So we are giving this fetus packed cells, O negative packed cells. But the fetus at the moment is having decompensated flow. You can see the reversal of ductus venosus, reversal of systolic flow in between the two beats. There you see my needle tip. This is the needle coming into the umbilical vein in the liver. So here we give packed cells, O negative packed cells, according to the weight of the fetus. We have done around 800 plus cases so far. Intrauterine blood transfusion for RH incompatibility cases. There we are. This is the needle, and there you see the needle tip. You can actually see blood going in. You can see the particles. There you see the particles moving, and here also, here as well. I'll show you once again. There, this one, this shining particle as we are pushing the blood in. So, my dear, this is it. This is ductus venosus, where we see mixing of colors, high velocity colors. These colors on this color palette are the one which are bright and light, the yellow and the sea green color. They are high velocity color as the blood passes through the ductus venosus. Here you can see the umbilical cord, 1, 2, 3. This is the umbilical cord, normal flow. This is normal flow. Last two videos of saphenous vein, saphenofemoral junction. This is the saphenous vein. We'll show you on a patient in a moment. This is the great saphenous vein entering the femoral vein in the groin. And now you will see that I will ask the patient to take a deep breath and bring his or her tummy out, the so-called Valsalva maneuver. There you see, Valsalva maneuver, and this, there is reflux of blood. This red color shows that, and again, when the patient start breathing, it will come down. And again, you see, on Valsalva maneuver, there is reflux of blood. And then they stop pushing the abdomen, so it becomes normal. This is venous flow towards the umbilical, towards the femoral, and when the patient takes, performs the Valsalva maneuver, blue color will stop and the blood will move backwards through the, yeah, there you see. The blood is moving back. In fact, sometimes, there you see, normal flow from the great saphenous to the femoral vein. And now I'm going to ask, yes, there you see, there is the flow stops, and then there is red flow which is showing reflux of blood from the femoral into the saphenous vein. So this is how we confirm the incompetency. of the saphenous vein. So now we will set up the machine for you and we will see the patient. Challenge patient. पहले दाहिनी का भेजोगे नहीं, वो भी टाइम लेगा, एब्डोमेन करना। आप पहले भेज, आप कितने वीक है? Can you hear me? Just raise your hand. Okay, okay, fine, thank you. ठीक है, भेज दें जी. So we are going to start a growth scan of around 29 weeks fetus